Part 2. Conversation Practice. A review of last week's conversation.
Gastrointestinal unit.
胃肠科
The components of the gastrointestinal system.
The gastrointestinal system is comprised of the digestive tract and several organs which assist with processing food. The digestive tract begins at the mouth and continues to the esophagus, stomach, small intestine, large intestine, and rectum. The organs associated with the digestive tract include the salivary glands, which secrete saliva, the liver, which handles nutrients absorbed by the small intestine, the gallbladder, which stores bile, the pancreas, which secretes digestive enzymes and hormones which regulate metabolism. From the microscopic level, the digestive tract is approximately divided into 4 layers: the mucosa, submucosa, muscular layer, and serosa. The mucosa is where nutrients are absorbed and is the first barrier for numerous pathogens and noxious substances. If only the mucosa is damaged, this is called erosion. However, if the injury is serious enough to also damage the muscular layer, we call this an ulcer, or ulceration.
Terminology. 1. Esophagus. Esophagus.
食道
2. Stomach. Stomach.
胃
3. Small intestine. Small intestine.
小肠
4. Large intestine. Large intestine.
大肠
5. Rectum. Rectum.
直肠
6. Salivary gland. Salivary gland.
唾腺
7. Saliva. Saliva.
唾液
8. Liver. Liver.
肝脏
9. Gallbladder. Gallbladder.
胆囊
10. Bile. Bile.
胆汁
11. Pancreas. Pancreas.
胰脏
12. Mucosa. Mucosa.
黏膜层
13. Submucosa. Submucosa.
黏膜下层
14. Muscular layer. Muscular layer.
肌肉层
15. Serosa. Serosa.
浆膜层
16. Erosion. Erosion.
糜烂
17. Ulcer. Ulcer.
溃疡
Case information. Peptic ulcer. Peptic ulcer.
消化性溃疡
Admission assessment. Mr. Liu, a 70-year-old man, passed black stools.
When did you pass black stools? How did you feel after this?
Last night, I felt dizzy and my heart started beating faster after I went to defecate.
Have you ever passed black stools before?
No, this was my first time.
All right. What other clinical signs did you have?
Well, I felt like I had abdominal pain.
When did this begin? Did it come suddenly or gradually?
2 weeks ago. It came gradually. I felt some discomfort, followed by some pain.
When did you feel pain? In the morning or in the evening? Before meals or after meals?
Right after meals. It continued even when I was hungry.
What did it feel like? Burning, tearing, or cramping? Did it extend to other areas?
It felt like burning pain, but didn't spread much.
What did you do to relieve the pain?
I went to the pharmacy and got some antacids. The pain was relieved after taking these medications.
Did you feel distended after meals?
Yes, even 4 or 5 hours after meals, I still feel like there was a lot of food in my stomach.
Are you currently taking any medications regularly? For example, aspirin?
I take statin to lower my blood lipid levels.
Do you smoke? If so, how long have you smoked, and how many cigarettes do you smoke a day?
Yes, I've smoked 2 packs a day for the past 40 years.
Okay, please lie down and rest. I'll be back in a bit.
Vocabulary and sentence examples. 1. Suddenly, suddenly.
忽然地，
2. Gradually, gradually.
逐渐地，
3. Tearing, tearing.
撕裂的，
4. Cramp, cramp.
抽筋，痉挛，
5. Pharmacy, pharmacy.
药局，
6. Medication, medication.
药物，药物治疗，
Terminology. 1. Antacid, antacid.
制酸剂，
2. Aspirin, aspirin.
阿司匹林，
Hospitalization. Mr. Liu was admitted to the gastrointestinal ward. His hemoglobin level was low.
Mr. Liu, was your last bowel movement black?
Yes, it was black.
Okay, I need to check your heart rate and blood pressure.
Later.
Your heart rate is 110 beats per minute, and blood pressure is 92/54 mmHg. These numbers may be caused by internal bleeding.
That sounds bad. What should I do?
We'll put you on an intravenous drip to supply fluids and give you a blood transfusion if your hemoglobin level remains too low.
I'm still weak and dizzy. What has the doctor done to deal with this?
The doctor has arranged an endoscopy to check your esophagus, stomach, and small intestine. If there's a bleeding site found, the doctor will try to stop it directly.
I see. Is there anything I have to do before this examination?
First, you have to sign a consent form in regards to understanding the purpose, process, and complications of this procedure. Second, you have to be NPO from now on.
What does NPO mean?
It means you can't eat or drink anything by mouth, including water and medicine.
I'll keep this in mind.
The doctor has already ordered an acid reducer, which will be given via an intravenous drip to stop the bleeding.
All right. Will I feel better later?
Yes, you'll feel better if the bleeding stops. Please call us if you feel worse or want to get out of the bed.
I will, thank you. Vocabulary and sentence examples. 1. Ward, ward.
病房，
2. Bowel movement, bowel movement.
排便，肠蠕动，
3. Blood pressure, blood pressure.
血压，
4. Consent, consent.
同意，同意书，
Terminology. 1. Hemoglobin, hemoglobin.
血红素，
2. Intravenous drip, intravenous drip.
静脉点滴注射，
3. Blood transfusion, blood transfusion.
输血，
4. Endoscopy, endoscopy.
内视镜检查，
5. NPO, nothing by mouth. NPO, nothing by mouth.
进食，
6. Acid reducer, acid reducer.
制酸剂，
Discharge instructions.
Mr. Liu, your condition is stable now, and the doctor said you're ready to go home.
Great. But I'm worried about what I need to do if I pass another black stools again.
Come to the ER immediately if you have black stools, abdominal pain, dizziness, or feel faint.
I see. Thank you.
You're welcome. The doctor has prescribed some medications for you to take home. Please remember to take them as instructed.
Don't worry. I'll keep this in mind. Anything else I should work on?
Yes. Relax more and maintain a regular lifestyle. This means maintaining a good mood, not smoking, and not staying up too late.
Okay. I'll try my best.
Also, try to eat a healthy diet. This means maintaining a balanced diet with nutrition, low salt, and avoiding preserved, canned, and stimulative foods.
Wow, I have to remember a lot.
Yes, this can all help you improve your health. Furthermore, always check your stool's color, and don't take other painkillers within the next 2 weeks. The doctor has already prescribed meds for you.
I'll pay more attention to these instructions.
Good. Then congratulations to you.
Vocabulary and sentence examples. 1. Stable, stable.
稳定的，
2. Faint, faint.
昏厥的，即将昏倒的，
3. Prescribe, prescribe.
开药方，
4. Lifestyle, lifestyle.
生活形态，
5. Canned, canned.
罐装的，
6. Preserved, preserved.
腌制的，
7. Painkiller, painkiller.
止痛药，
8. Congratulations, congratulations.
恭喜。
The conversation of this week.
Gynecology unit.
妇科，
The components of the female reproductive system. Several organs make up the female reproductive system, including the uterus, where the fetus develops and grows, the ovary, where the ovum is produced and matures, the fallopian tube, where the ovum meets the sperm, and the vagina, through which the fetus is delivered. These are all very important for maintaining pregnancy in women. Their function and structures are highly dependent on the levels of serum estrogen. The uterine structure changes during every menstrual cycle. The endometrium grows in the follicular phase of the menstrual cycle and further becomes mature in the luteal phase for the conception of a fertilized egg. If there's no fertilized ovum, the thickened endometrium will break down and will be eliminated through the vagina. The menstrual cycle occurs every month, starting from puberty until the age of 40 or 50. As one ages, the number of available ova decreases. Menopause then occurs, ending the menstrual cycles.
1. Uterus, uterus.
子宫，
2. Fetus, fetus.
胎儿，
3. Ovum, ovum.
卵子，
4. Fallopian tube, fallopian tube.
输卵管，
5. Sperm, sperm.
精子，
6. Vagina, vagina.
阴道，
7. Uterine, uterine.
子宫的，
8. Endometrium, endometrium.
子宫内膜，
9. Follicular phase, follicular phase.
滤泡期，
10. Luteal phase, luteal phase.
黄体期，
Case information.
Ovarian cancer, ovarian cancer.
卵巢癌，
Admission assessment. Ms. Wang was admitted because of sustained abdominal pain.
Good morning, Ms. Wong. What brought you to the hospital today? I've been having abdominal pain that's been really bothering me. How long has it been? Since 2 months ago. In the beginning, I felt dullness and fullness around my navel. I initially thought it was caused by poor digestion, so I took some antacids for it. Did you feel better afterwards? No. The discomfort continued and became worse. I went to the clinic and then was referred to the gynecologist here. Okay. Has your menstrual period been regular recently? Yes, it has been regular recently. Well, did the doctor tell you the results from the ultrasound examination? Yes. There's a tumor in my right ovary. He suggested that I receive an operation. Yes. The operation will remove the tumor and the Department of Pathology can identify whether it's benign or malignant. Got it. What time will the operation be? scheduled at 11 a.m. tomorrow, so you have to be NPO after midnight. I see. Thank you.
Vocabulary and sentence examples.
1. Bother, bother.
使扰人
2. Navel, navel.
肚脐
3. Digestion, digestion.
消化
4. Benign, benign.
良性的
5. Malignant, malignant.
恶性的
Terminology.
1. Gynecologist, gynecologist.
妇科医师
2. Menstrual period, menstrual period.
月经周期
3. Ultrasound, ultrasound.
超音波
4. Pathology, pathology.
病理学
Hospitalization. Ms. Wang's operation was completed, and she was returned to the ward from the recovery room.
The operation was performed and went quite smoothly. Your tumor was excised with your ovaries, fallopian tube, and uterus. I know. What are these tubes for? They aid in draining the discharge from your wound. The nurse on duty will change the drainage bag every 8 hours. When will you take them out? We'll take them out when the drainage is less than 50 cc per day. Meanwhile, the color of the fluid should be clear without pus or blood. I see. What is this tube for? Since we removed your pelvic organs, your bladder function will temporarily be affected. That urinary catheter will help you urinate. We'll remove it when your bladder function returns to normal. It will take 2 to 3 days. Got it. Thanks for the explanation. You're welcome. During the next few days, please stay in bed. Try to breathe deeply to improve your lung function. But it hurts when I take a deep breath. This machine, called a PCA, will give you painkillers whenever you press this button. Now, try to take a deep breath. Are you still feeling pain? Not at all. This is a great design for people like me. That's right. If you still feel any discomfort or your drainage becomes bloody, please call us for help. I will. Thank you very much.
Vocabulary and sentence examples.
1. Recovery, recovery.
复原
2. Excise, excise.
切除
3. On duty, on duty.
值班
4. Pelvic, pelvic.
骨盆的
Terminology.
1. PCA, patient-controlled analgesia. PCA, patient-controlled analgesia.
病人自控式止痛器
Discharge instructions. Ms. Wang prepared for discharge while the nurse informed her about some important information.
You can go home after we remove these tubes. Congratulations. Thanks for all your care. You're welcome. The Port A catheter was inserted around your right shoulder. You will receive chemotherapy via this route. When should I come back for a follow-up exam? Next Wednesday. The first dose of chemotherapy will be administered at the same time. I see. Anything else? Due to the operation, you no longer have endogenous estrogen to prevent the loss of calcium from your body. For this reason, you have to eat foods higher in calcium. What kind of foods should I eat? In addition to dairy products, you should eat tofu, Chinese cabbage, and drink soybean milk. What kind of exercises can I do? All strenuous sports should be avoided for the next 3 months, including jogging, jumping, and riding bikes or scooters. Mild exercise is permissible. For example, speed walking. I'll try to remember this. Anything else? Avoid having sex for the next 6 weeks. Okay, I'll keep this in mind.
Vocabulary and sentence examples.
1. Administer, administer.
给予提供
2. due to, due to.
由于
3. Endogenous, endogenous.
内生的
4. Dairy product, dairy product.
乳制品
5. Permissible, permissible.
可允许的
Terminology.
1. Port A catheter, port A catheter.
Port A 导管
2. Chemotherapy, chemotherapy.
化学治疗